Hello everyone, this is Bob Sullivan, a paramedic pharmacology medication dose calculation, part 1. And we're going to start by talking about the difference between dose of a medication and the volume that the medication is packaged in. And we're going to use this to build on calculating the amount of volume from a vial of medication that we actually want to give to make sure we give the correct dose. And then we're going to talk about the concentration of a medication and the ways to do that. So start by talking about what a dose is. The dose is the amount of the medication, or the weight of the medication, or the strength of the medication. And that is going to be labeled in a weight. So it's grams, milligrams, micrograms. There are some others, but we're going to, the calculations we're going to work on today are just going to be stick to grams, milligrams, and micrograms. And sometimes we're going to need to convert a weight. A medication may be packaged in grams, but we need to give a dose in milligrams. So we're going to convert, and we'll do some examples of how to do that later. But we'll start with a gram is 1,000 milligrams. And a milligram is 1 micrograms. So that's the weight. The volume is the amount of liquid that dose of medication is packaged in. And the volume is going to be in mostly milliliters and occasionally liters. If we're talking about the liters, that's usually going to be an amount of fluid that we're going to infuse over a specific time, maybe for shock or a patient's bleeding or burned. Most of the medications that we're going to calculate to administer are in milliliters. The concentration is the amount of a drug, and we'll just say milligrams or micrograms or grams in 1 milliliter. So sometimes medications come packaged nicely, sometimes they don't. We have to do a conversion. So for volume, these are examples of how medications are packaged or delivered. This is a liter, 1,000 milliliters. It's a liter of fluid. This is 500 milliliters, or 0.5 liters. These are usually used in EMS, at least for volume resuscitation. So we're going to start an IV either to give a patient fluids or to have a line available that we're going to give other medications through. 250 milliliters and 100 milliliter solutions are usually used to mix medication. So we're going to dilute medication from a vial, and we're going to infuse that over a period. Now, to draw up medications, we're going to use syringes, and these are different size syringes. So this is 1 milliliter, and so if we were to take 1,000 of these syringes, that would make 1 liter. So 3 milliliters, 10 milliliters, 20 milliliters. So as we're going to see, we want to use the smallest syringe we can, because if we wanted to give, say, 0.1 milliliters of medication, if we use a 10 ml syringe, that's going to be really difficult to get any degree of accuracy for that. So whenever we're calculating our medication dose, we want to choose the syringe that the smallest syringe that's available. And these are 60 milliliter syringes, 100 milliliter syringes. These aren't used, at least in my area, these are not used often. They may have been used for inflating air into airway devices. but these are also here available to give medications through. So this is our volume. So one other thing, this is a saline flush. These flushes are used when we're starting IVs to flush the line to make sure that it's patent and it's in a vein. And it may also be used to dilute medications, and as we'll see and do some problems with later. So.